Hi, my name is Sonia. I'm here to show you how to change a dressing with a wound that actually has some, it could be meta-honey in it, it could be slough, we're not quite sure, but I wanted to show you how to clean a wound and how to fill undermining around the wound. This dressing that I'm showing you today is pretty much a basic dressing change that we're doing wet to moist dressings. Okay, so this could be for any wound that even if we haven't seen the patient yet, you can do this process with cleaning the wound, putting a moist gauze dressing inside the wound. So that applies to a situation where you have an open, moist wound and we haven't been there yet to see it and folks don't know what to do. Just go ahead and do this process. Okay, first of all, here's our wound. What's really nice to use is this no sting adhesive remover for any tape because it just easily removes the tape and there's less pain. The patient will really thank you for using this. What I do is I find the notch, I rip it open. If there's some liquid inside, I pour it on the edges, kind of let it saturate. Then I grab my little square and then I start to get this off. And generally it'll peel right off. Okay, so here's my gauze that's on my wound. Now, if this gauze sticks to the wound, please feel free to use some saline and just saturate it with saline, and that'll help it come off as well. Okay, so it's saturated. We're going to take this off. Okay, there's lots of stuff in that wound that we're going to clean. So what we use, generally we like this type of gauze. This is called the fluff gauze. This is a woven gauze and it looks like this versus we don't like to use this so much to clean wounds because it doesn't really grab hold of the debris. So we'll use this, we'll take our saline and we can moisten this and then we're going to clean the wound and any debris, and we do want to use enough pressure to get that clean. Okay, so I'm cleaning this inside and also the outer portion. Okay, this is the peri wound, so we want to get any debris off of that, make sure it's good and clean. Okay, now inside, may not know this, but if you use a Q-tip or sometimes your gloved fingers, you can see that there's a lot of space under here. This one actually has circumferential space or undermining. I wanted to clean in that undermined space, so I'm going to take the saline, this just regular saline, and we always use saline to clean wounds. We don't use that sterile water. So I'll just pour this in my gauze. And I don't want it sopping wet, so I'll squeeze out some of the excess water. And since I've found some undermined spaces under here, I'll use my gloved hands to get under there and clean that area. Now, if this is too hard to do, you can squirt some saline inside and then use your wet gauze to kind of clean inside of there, okay? So what we do now is we want to fill that space gently. We don't want to overpack like a suitcase. We don't want to compress the tissues or the walls apart, so we're not going to stuff it full. We're going to just put a little bit of roll gauze in there that we've moistened with saline. Now, there's two different kinds that I found here. One is just the typical Curlex roll gauze. Another is called conforming stretch gauze bandage. Either one is fine. This one might work better because we don't have a huge space, so it's smaller. So I'm going to use this, and now I'm going to fill the wound with this roll gauze, and we use one continuous piece. I want to moisten it, so I pour my saline into here. I squeeze out any excess. And then this moistened gauze, I'm going to gently fill those areas. You can use your fingers, and this is basically done as a wicking gauze. We're not packing it full of gauze, just enough to get back into those deepest spaces. So if this goes all the way to the end, I do want to gently get to that end and keep going. all the way around wherever there's space. Okay, so don't be afraid to put this in that space. The concern is that if we don't put this in the space, the liquid or fluid inside will just collect and create an abscess. Say this part seals down, but this one doesn't because we haven't put the gauze far enough. You could create an abscess in there. So we do want to fill this area and any surrounding spaces. Well, this goes in pretty nicely. And see, I'm just using one continuous piece. And then I'm covering up my wound as well, the wound I can see. Okay, so I'm filling that area. And generally I like to cut this away from the wound. Okay. Now, one thing that's also important is that we may ask you to use the Cavalon No Sting Barrier Film on the peri-wound skin in order to protect that skin from drainage or the moist gauze that we've just put in. So we'll just take this out. Protect that wound around the edge. Okay, we let it dry. It dries in about 5 to 10 seconds. And then we can put another dry gauze over this if we wanted to. Doesn't matter what kind of gauze you use on the top. Let's say we did that just to cover that and helps absorb some moisture. And then I'm going to put this is just a Stratasorb, and then we just put our dressing on over the top. Okay. Now, another thing that's really nice to do is date and time your dressing. So today is 1/20, and let's say it's 1300, and then you put your initials on there. Okay, so everybody knows when you changed it.